Should I get the whooping cough vaccine if I'm pregnant?
Whooping cough can affect people of any age, but babies under 1 year old are most at risk. For these babies, the disease can be very serious and can lead to pneumonia and permanent brain damage. In the worst cases, it can be life-threatening. The whooping cough vaccine is offered during pregnancy, and getting this vaccine will protect your baby from birth up to the start of their routine childhood immunisations. The immunity you get from the vaccine will be passed to your baby across the placenta. Vaccination is the only way to protect your baby from whooping cough in the first few weeks of their life. Your protection from either having whooping cough in the past or from being immunised when you were young will now have worn off. By getting vaccinated during pregnancy, you will also lower your own risk of whooping cough infection and the risk of passing whooping cough to your baby.